In your headlines, authorities announced the reopening of the Turks police station, and a locally sourced handmade straw hat was modeled on the Miami Swim Week runway. Hello Turks and Caicos, welcome to PTV News Watch. Thanks for tuning in on this Thursday, July 21st, 2022. I'm Khalees Williams with today's newscast. The real news starts now. Authorities announced the reopening of the Turks police station after a blazing fire left officials with months' worth of renovations. Here's more.
Almost a year after a fire destroyed the evidence room of the Turks police station, the precinct is now reopened. The announcement was made on Monday, July 19th, that all previously accessed services would now be made available. However, questions still remain regarding the circumstances surrounding that fire that left the facility inaccessible. Back in September of 2021, images and reports surfaced of a fire to the evidence room of the Turks police station, where sources say about $190,000 went missing and an abundance of evidence destroyed, along with furniture and IT equipment. One officer was placed on administrative leave shortly thereafter. However, no definitive reason was given behind the timeout. However, police officials spoke to the procurement of independent investigators for the inquest into the circumstances of that fire. However, no details on the inquest or findings have been revealed to the public to date.
Post-COVID condition is making headlines, but is it something we should be worried about? Minister of Health and Human Services, Honorable Jamel Robinson, is up next with the details.
While much remains unknown about the impact of this post-COVID condition, medical professionals around the globe say that health systems must prepare for the long term. However, our minister doesn't think that Turks and Caicos will be impacted by the condition.
I don't think the impact will be great because we do have the vaccination mandate in place. And what the vaccine allows, meaning that all the tourists that come in having to be vaccinated outside of a medical exemption, which is given very sparingly, is that if they are in, the chances of them spreading the virus or becoming significantly sick while in country is reduced because of that. And hopefully most persons would have taken their booster shot by now, which would kind of re-up their immunity towards COVID-19. This is in addition to the various strands of COVID-19 being less impactful, so to speak, in terms of causing severe illness, even though there's still ability for it to spread. So we still have cases that kind of fluctuating between 25 to 35 on a weekly basis, meaning in terms of the total active amount of cases that we see in any one particular day or during a week. But that is more than manageable given everything we've been through so far.
Although the Minister of Health says it's unlikely that the Turks and Caicos would be greatly affected by the long COVID or post-COVID condition, he still acknowledged that persons who might be affected by this will need proper medical attention.
We have our healthcare system that's in place clearly. So persons who need the additional treatment that they might have, they just need to access the facilities, whether it's from a primary healthcare standpoint, whether it's the visits to the hospital that are here locally, so we can get ahead of and on top of any particular ailments they might have from what is considered long COVID. So there's a likelihood that there will be some type of spike in relation to persons who had or who might have long COVID, even though that's a smaller percentage of all overall persons who would have had COVID, the COVID-19 disease, particularly those who would have had the stronger strands, so your deltas and your earlier variants. So that's something that we can monitor and pay attention to.
As multiple health organizations are calling for increased support for patients with post-COVID condition and for health systems to acknowledge this long-lasting effect of the pandemic and help address it, the minister was inquired on if the Turks and Caicos' health systems are ready for the long term.
In terms of that, is that clearly any system can be improved, and that's what we are working on here in the Ministry of Health. But I would also say that compared to many health systems in the region, I think we have one of the best in terms of your access to healthcare, because we have a system between the primary healthcare, secondary healthcare, which is provided by the TCI hospitals and the NHIB program, where we have access to tertiary care through the treatment abroad program, where almost just about in any situation you have access to some level of care. It's just a matter of where you access it. So what you don't have available on island, meaning in country, then we would refer you to an overseas provider, which is a complete package. So essentially we have universal health care. So while there are places where we can improve it throughout the whole entire chain of our healthcare system, which we are working on, and which is my focus, particularly coming out of the COVID-19 pandemic, the mechanism is in place to provide healthcare like many other countries only wish they could have.
Also, one crucial thing to recognize of the impact that post-COVID condition has on people's lives is mental health issues. If the challenge were to present itself, Honorable Robinson assures that our mental health department is getting ready.
I think we're getting ready, and that's why we would have invested in setting up the new medical health facility in Grand Turk, which hopefully before the end of the next quarter will be functional. We've already hired the additional staffing complement to be able to run such an organization that will allow us to deal with any new cases that are likely to come on because of the stresses of COVID-19, in addition to the patients that we have outside of the country in Jamaica and other places can come back home and actually receive treatment and care locally. So we aren't there yet, but we've put in all the pieces where we'll be in a very good position. And of course, if additional resource needs arise over the coming years, then clearly we would want to respond to that and make the appropriate preparation. And one of the things that we are doing within the ministry is having a greater focus on primary health care, because if we can curb the need to utilize secondary and tertiary care within the system, then we can provide savings, and those savings can be used to things like mental health, primary health care in general, as well as our response capabilities within the Ministry of Health. So we're trying to curb some of the things, the long-term issues that we experience as a young nation. So we're in a position to be able to better focus the resources that we do have at our fingertips.
Newswatch has gathered that rehabilitation is one of the 3 R's to combat this condition. Managing post-COVID condition requires a multidisciplinary approach with physical therapists, occupational and speech therapists, mental health professionals, nurses, and doctors working together in a holistic manner.
But we have all the components, and those components work together hand in glove, where there is synergy between the various levels of primary health care, your secondary health care, the hospitals, as well as the tertiary health care provider. So in the instance of that team, so you have what we call the Joint Referral Committee, which does a lot of collaboration for persons, and they will review whether or not persons need to seek help overseas or whether it's be able to be provided here. So there is, between the ministry, the hospitals, and primary health care, the mechanism by which persons who need the assistance can get it.
And as the minister assured that our medical team is trained and equipped adequately to manage patients with COVID, he says that the team will monitor cases, or in other words, be on the lookout.
As people present themselves specifically with any ailments to the healthcare system, whether it's from a primary healthcare need or a secondary healthcare need in terms of if they have to interface with the hospitals, that is essentially the mechanism which will be utilized to treat them and give them access to the hospital. So you can have your regular clinic visits where you can meet primary healthcare nurses and or doctors at that level, or utilizing the clinics on the various islands throughout the Turks and Caicos Islands outside of the ones that are set up within the TCI hospitals. And if your ailment can't be treated, then it could be passed up to the TCI hospitals, and or you can't forget the private sector medical facilities that are available as well. So you might just be visiting your personal doctor if you don't want to interact with primary health care.
So should the long-term effects of COVID be something for the Turks and Caicos population to worry about?
We aren't completely out of the woods of the COVID-19 pandemic. So continue to exercise caution and protect yourselves. Ideally, you wouldn't want to catch COVID in general if you could avoid it, generally speaking. Clearly, long COVID, for those who have caught it or who have gotten the conditions designated as long COVID, it isn't going to be an easy road back to recovery overall. So it isn't ideal. So you would want to avoid it if possible. And the only way to avoid it is not to get COVID in the first instance. So do what you can to protect yourselves and be safe.
We'll be right back with more Newswatch when we return.
This is a reminder that all PTV service accounts are due on the first day of each month. Accounts should be brought up to date by the 28th of the month to avoid disruption in service. Payments may be made on our office at Stubbs Diamond Plaza, Providenciales, Mides Plaza, North Caicos, and Airport Road in South Caicos. Payments may also be made online using Scotiabank, CIBC First Caribbean Bank, and Royal Bank of Canada. Please allow 3 business days for online payments to be processed. We thank you for your cooperation.
Welcome back to Newswatch. A locally sourced handmade straw hat created by Irene Higgs was modeled on the Miami Swim Week runway, and Newswatch got an interview with the creator earlier today. Here's more. The creator of the hat introduced herself as Irene Higgs and spoke about what she creates.
I did my plaiting, I do my hats and other different things.
Ms. Higgs then went on to say how and when she got into making straw hats.
Long years ago, about around in the 50s, we had federation. We used to have federation those days. And I joined the federation. So I started making hats, baskets, but I was into the hats more. And other things, crochet and other things, but the hats, them, I plaiting and going on, I was into that more.
Ms. Higgs shared with Newswatch how fast she can produce one of her signature hats.
I just sew 2 hats in a day.
Ms. Higgs spoke of how her creation ended up on the Miami Swim Week runway.
As a girl, just do modeling for beaches, and I had a contract with her for hats.
Newswatch inquired about how Ms. Higgs felt seeing her very own hat on display and whether or not she thinks that this exposure will bring in more customers and revenue.
Oh, that was marvelous to me. Feeling like this, seeing my hats in Miami, I feel big, Yeah, I will. Once I be in good shape and feeling like this.
In her final remarks, she spoke about how thankful she was to Miss Cypriana Green for taking her hat to the runway.
I thankful for what I saw on the WhatsApp. I thank her. Yes, she called me. She called me yesterday and tell me what a marvelous job, and she thanked me and couldn't praise me enough.
In this next story, we bring you the latest from the Premier, who has instated a duty concession on specific items for residents to begin and go into effect in another 2 weeks. Newswatch has the details.
For 4 months, residents will benefit from a duty concession on bread basket items beginning on August 1st.
But whether it circulates or whether it goes out to buy goods, people still have to survive. We don't grow cream of wheat here. We don't can sardine here. We don't grow rice here. So the money has to go back out. Unfortunately, that's the problem with these small, vulnerable island states.
The premier says the reality is that none of the major necessities are manufactured here in the TCI. Hence, his government seeks to make livelihood more sustainable through affordable duties and overall concessions on these necessities. To this, residents will also receive a $600 exemption on items from non-business related travel, $200 up from the $400 currently in place.
The government has agreed to provide a waiver of customs duties and customs processing fees on certain staple and breadbasket items imported to the islands from August 1 to November 30th, 2022, while we keep our eyes on price inflation. Cabinet today approved a $600 exemption per returning resident on purchases imported on non-business related trips. This is $200 increase from the current $400 currently exempted. Additionally, it tends to remove the requirements to complete customs arriving passenger declaration forms at all international airports effective August 1st, 2022, on goods below the personal allowance of $600.
This concession was just one of the three components of the $16 million inflation relief package, which also included a $1,000 stimulus and a review of the Works program to provide additional jobs in the economy. A list is to be issued with the items that will be a part of the breadbasket inflation relief concession package. These measures are to take effect on August 1st.
Don't move just yet. Coming up next is your weather forecast after this break.
This is a reminder that all PTV service accounts are due on the first day of each month. Accounts should be brought up to date by the 28th of the month to avoid disruption in service. Payments may be made on our office at Stubbs Diamond Plaza, Providenciales, Mides Plaza, North Caicos, and Airport Road in South Caicos. Payments may also be made online using Scotiabank, CIBC First Caribbean Bank, and Royal Bank of Canada. Please allow 3 business days for online payments to be processed. We thank you for your cooperation.
Here at People's Television, we're more than just your leading news and entertainment services. We are
spreading the gospel.
We are breaking barriers.
We are preserving the culture. Each one, teach one.
We are committed to excellence.
We're creating change.
We are creating memories.
We are the future.
I am PTV.
I am PTV. I am PTV.
I am PTV.
We are PTV.
We are continuing the legacy. We are PTV.
Welcome back to Newswatch. Here's the latest in your weather forecast. For the nation's capital, Grand Turk, isolated showers, high 84, low 80, winds east at 20 to 30 miles per hour. For South Caicos, isolated showers, high 84, low 80, winds east at 20 to 30 miles per hour. For North and Middle Caicos, isolated showers, high 85, low 80, winds east at 15 to 25 miles per hour. For Parrot and Pine Key, isolated showers, high 85, low 80, winds east at 20 to 30 miles per hour. And on Providenciales, isolated showers, high 85, low 80, winds east at 20 to 30 miles per hour. Here's your sunrise and sunset. Sunrise, 6:18 a.m., sunset, 7:34 p.m. Now for your high and low tides. High tides, 3:27 a.m., 4:06 p.m., low tides, 9:32 a.m., 10:35 p.m. And for your hurricane outlook, for the North Atlantic, Caribbean Sea, and the Gulf of Mexico, tropical cyclone formation is not expected during the next 5 days. And that's it for your weather forecast and hurricane outlook. That's the end of today's edition of Newswatch, but don't forget you can always catch us on our website at www.ptv8tci.com and every weekday right here at 6:30 p.m. I'm Khalees Williams. Stay informed. Thanks for watching.